So, medical marijuana refers to the use of the marijuana plant or its extracts to treat various medical conditions. It contains compounds like tetrahydrocannabinol, THC, and cannabidiol, CBD, that may have therapeutic effects. Medical marijuana is used to alleviate symptoms such as pain, nausea, and muscle spasms in conditions like cancer, chronic pain, and multiple sclerosis. It is also said to help conditions such as epilepsy, autism, and many more, although it is a topic of ongoing research and debate. However, its legality and acceptance vary globally, and research on its efficacy is ongoing. Patients often access it through prescriptions or in states or countries where it's legal, typically in forms like oils, capsules, or vaporized products. Today, no medical marijuana laws or patient protections exist in Malaysia. As such, even simple possession for medical use can incur strict legal punishments. It is important to note that the medical community is continually researching and studying the potential benefits of medical marijuana, and the effectiveness can vary among individuals. Additionally, the legal status of medical marijuana varies globally and within different regions.
Patients should be fully informed about the risks, potential side effects, and uncertain long-term consequences of using medical marijuana. Ensuring patients are aware of these factors becomes an ethical imperative. Ensuring the quality, purity, and the standardization of medical marijuana products is an ethical concern. Lack of regulation and standardized dosages can pose the risk to the patient safety. One ethical consideration involves around the effectiveness of marijuana as a medical treatment and the addictive nature of marijuana, which is relatively least harmful to the body. However, marijuana also has harmful effects. It's hard to balance its strengths and weaknesses, such as dependence and addiction. Patients use marijuana as medicine may face judgment or discrimination due to social perception about its recreational use. This stigma would affect their mental well-being and access to other healthy care services.
The significant challenge we face is the scarcity of high-quality research on medical marijuana. Comprehensive study on its efficacy, dose-dependent, potential drug interaction, expected adverse effects, and the overall safety of commercially available medical cannabis products are lacking. Marijuana use, while often perceived as relatively harmless, can also have several potential side effects. Individuals may develop a dependency, leading to addiction and a significant impact on daily life. Chronic smoking of marijuana has been linked to respiratory issues such as chronic bronchitis and lung infection, which is similar to tobacco smoke. Also, prolonged use has been associated with potential mental health problems, particularly among those predisposed to conditions like anxiety or depression. Adolescents, in particular, are identified as the most vulnerable group. Studies have shown that adolescents have a 2 to 4 times higher likelihood of developing cannabis dependence compared to adults, which potentially negatively impacting the brain development. The adolescent's brain is still forming. Cannabis use during this critical period may disrupt these processes, potentially leading to long-term consequences, which may impair cognitive function, attention, and memory. We should also be concerned about the risk of diversion. This refers to the possibility that medical cannabis, legally obtained for therapeutic purposes, might find its way into the illicit market. This diversion can occur through various means, such as unauthorized resale, distribution, or procurement by those who do not have a legitimate medical need for marijuana.
So now we shall move on to the legalization of cannabis, looking at the different laws and regulations from around the world. I think there are more than 30 countries around the world who have medical cannabis legalization, many for medical purposes, such as Canada, Uruguay, Mexico, Colombia, Argentina, Peru, Germany, Belgium, Costa Rica, Puerto Rico, Jamaica, Bolivia, UK, Australia, Netherlands, Denmark, Spain, South Africa, Brazil, Estonia, and so forth and so on. Majority of these are basically for medical purposes. It varies from one country to another country, and so the legalization, particularly for medical purposes or for recreational. In Asia itself, it is actually still illegal in majority of the countries, in most of the countries, except for Thailand and in South Korea, where they legalized medical marijuana in the year 2018. Closer to home in Malaysia, we have the Dangerous Drug Act in 1952, and this act was again amended in 1983. In Malaysia, as we know, medical and recreational cannabis is actually illegal. Illegal, in terms of possession of it, usage of it, selling of it, or cultivation of cannabis. And it comes with severe penalties. And in 2023, we decriminalized, people having small amount of illicit drug possession and use. And we also abolished the mandatory death sentence with the new prime minister that we are having. Now, from here, we can see that around the world, there's a trend towards partial legalization of cannabis. And sometimes within a country itself, for instance, in the United States, conflicting state policies actually create ethical dilemmas, and the various stakeholders, patients, healthcare providers, or health delivery systems, they're all then impacted. And also, because of these conflicting policies within the country itself, the disparity in this law creates significant social and health inequalities in gaining access to the medical cannabis. All in all, you can see that there is a lack of comprehensive legal framework to regulate the production, distribution, and consumption of cannabis or marijuana products. What about the role and responsibility of healthcare providers as far as medical marijuana is concerned? I think healthcare providers, be it doctors, pharmacists, or nurses, I think they ought to be familiar with the national or state laws or policies related to medicinal cannabis use. And I think they need to seriously adhere strictly to prescription and the safety consideration if they are to prescribe any of the medicinal cannabis use for the patient. And all these healthcare providers also play an important role in terms of educating patients about marijuana, its therapeutic use, the benefits and risks for both short-term and long-term adverse effects. And ethically, they're responsible for patients' choice of treatment or symptom management without prejudice or judgment. And of course, as far as research is concerned, they need to have up-to-date knowledge on evidence-based research on cannabis and marijuana.
Education and training. Providing accurate, evidence-based information about the medical properties of marijuana, as well as training programs for healthy care providers. Policy reform. Developing clear regulation for medical marijuana use. Advocacy effects. Engaging in advocacy, building support, and fostering dialogue around the benefits and risks of medical marijuana can help reduce stigma and misinformation. Collaboration and partnerships. Collaborating with diverse stakeholders. Cultural and media influence. Encourage accurate and responsible portrayals of medical marijuana in media, entertainment, and popular culture. By providing accurate, sensible, and unbiased information, education plays a key role in shaping public attitude and opinions toward medical marijuana, contributing to a more informed and nuanced perspective on its use in healthy care.
While the use of medical marijuana is still a topic of ongoing research and discussion, there are some cases, studies, and anecdotal evidence that suggests its potential benefits for certain medical conditions. For instance, in the cases of patients having epilepsy, patients having chronic pain, patients having multiple sclerosis, where it was noted to help to reduce muscle spasm and pain. Patients undergoing chemo, where it was helped to alleviate symptoms such as nausea, vomiting, and loss of appetite. Patients having PTSD, where it elevates symptoms such as anxiety and insomnia. And also in glaucoma management, where it helped to reduce intraocular pressure. Based on historical trends and potential future direction, there has been some dilemmas in specific cases on the usage of medical marijuana, which needed to be considered. For instance, in conducting rigorous clinical trials to assess the efficacy and safety of medical marijuana for various medical conditions, for instance, in pain management, neurological disorders, psychiatric condition, and also other therapeutic application, understanding the optimal dosage and administration, the mechanism of action, investigating on how individual genetic and biological differences influence response to medical marijuana, the impact on mental health, cannabis derived pharmaceuticals, effect on aging and neurodegenerative disease, examining on how medical marijuana policies contribute to health disparities by investigating the impact of legislation on marginalized communities, conducting long-term observation studies and assess the sustained effectiveness and safety of medical marijuana, and assessing the impact of medical marijuana on patients' reported outcome and overall quality of life. There have been several lessons which have been learned from the studies and experience with medical marijuana. For instance, in the individual variability, where tailoring medical marijuana interventions to individual patients and closely monitoring their response is crucial, emphasizing the importance of evidence-based practice. The healthcare professional should also conduct a thorough risk-benefits assessment for each patient, taking into account the specific medical conditions and overall health and well-being of the patients. Patients' education has to be also important, where healthcare providers should take time to educate patients on the potential benefits, risks, and proper use of medical marijuana. Healthcare professionals must stay informed about the legal status and also the medical marijuana in their jurisdiction and adhere to the ethical guidelines, promote interdisciplinary care and communication among healthcare providers, and implementation of regular monitoring and follow-up with their patients who are using medical marijuana. Next, the future direction of medical marijuana, especially in the clinical efficacy across medical condition, where conducting robust clinical trials to investigate the efficacy of medical marijuana across the spectrum of medical conditions, including chronic pain, neurological disorder, mental health condition, understanding the dose optimization, patients who are conducting long-term studies to assess the safety profile of medical marijuana, deepen the understanding on specific mechanism of action of cannabinoids, understanding the pediatric and geriatric application, conducting comparative effectiveness studies comparing medical marijuana with standard pharmacological treatment, exploring the anti-inflammatory properties of cannabinoids and their potential in treating autoimmune and inflammatory conditions, investigating the genetic factors influencing individual response to medical marijuana, and also the public health impact, and last but not least, the integration with conventional treatment. Next, on the evolution of ethical guidelines, developing guidelines that emphasizes informed consent, ensuring that the patients are well informed about the potential risks and benefits of medical marijuana, establishing comprehensive education and training programs for healthcare professionals, addressing issues related to patients' privacy and also confidentiality, integrating guidelines that promote equitable access to medical marijuana treatment, developing and updating research ethics guidelines, encouraging guidelines that support healthcare professionals in advocating for patients' right to access medical marijuana, promoting ethical guidelines that facilitate collaboration between healthcare professionals, and developing guidelines that govern the ethical marketing and advertising of medical marijuana products.
Medical marijuana comes, of course, with its benefit and risk, and has its own medical and social cultural implication, psychological implication, and also its challenges. And you can see that increasing use of medical marijuana poses several ethical issues for the healthcare providers, particularly doctors, as well as their patients, the healthcare system itself, and of course, the sponsors of this study, the company. And the ethical issues includes, patients' autonomy, informed consent, and the balance between the benefits and the risks, social equity, and also access to medical marijuana. Now, from the healthcare providers' point of view, the ethical issue surrounds the lack of standardized dose and formulation, potential misuse of medical marijuana, and the adverse effects, and also the impact on vulnerable population. There are, of course, cannabis laws, regulations, and guidelines around the world, but it differs from one country to another country, whether it's pertaining to legalized medical or recreational cannabis use. So healthcare providers need to educate the patients, the community itself about the effects of medical marijuana. And of course, there are more, we do need to have more evidence-based research to guide clinical practice and policy implementations, and the findings should be integrated into the mainstream healthcare. All in all, in the current landscape of medical marijuana, we need to balance the medical and ethical consideration. With that, thank you.